We have a new report out that seeks to answer the question, how many coronavirus deaths can we really attribute to former President Donald Trump? And, one of the things we knew intuitively during the Trump presidency, and which was confirmed a number of times by different studies, was that no president could have predicted every coronavirus death. No president could have even prevented, rather than predicted. Predicted is a different thing. No president could have prevented every coronavirus death. We were going to have many deaths, as even countries that dealt with the virus well had many deaths. But the lack of taking the virus seriously by the Trump administration from day one certainly was at least partially responsible for some of the deaths. A new report now says that 40% of the deaths that took place in 2020 could have been avoided if Trump had merely handled the virus well enough for the U.S. to have the same, not number of cases, but mortality rate of other wealthy countries at our level of development. This study was published in The Lancet, one of the oldest and best known medical journals, and it explains that the U.S. Had way more deaths, a higher mortality rate during the pandemic than other rich countries including the UK and a number of other countries, and that many of the cases and deaths were avoidable. They could have been avoided by the federal government response being more serious from the beginning, rolling out testing earlier on, having stricter guidelines, or at least making it clear that they should be enforced and that Donald Trump wanted to see those enforced. And unfortunately, some of these problems date back even before Donald Trump. We know that the United States, when it comes to healthcare, even though we spend a ton of money on healthcare, we often have worse outcomes than many other wealthy developed countries, Germany, Canada, UK, so on and so forth. And so part of this is a bigger problem than Donald Trump. A lot of our systems not interacting well, federal and state not interacting well, so on and so forth. But then beyond that was the failed federal response from Donald Trump. And I think a lot of us intuitively understand this. The number of infections early, the lack of just being realistic, the lack of letting actual medical professionals guide the response. And as I've said before, if indeed Donald, and we'll talk about this in a moment when we talk about Joe Biden's approval rating, if Donald Trump had simply said, what do doctors think we should do? What do public health experts think we should do? Epidemiologists, immunologists, people who know about this and aren't going to say things like, would the flu vaccine work against coronavirus, as Donald Trump did back in, I don't remember if it was February or March, many of these deaths would have been avoided. And we now know that beyond any doubt whatsoever. And the question now becomes, under new leadership, can we do as well as other countries when it comes to vaccine distribution and lowering the mortality rate and keeping cases low if and when we get them low? So far, the numbers are cautiously optimistic. We had a couple days in the last week where there were 2 million vaccinations done each day. If indeed we have a third vaccine approved sometime in the near future, as it looks like we will, it's not completely unreasonable to think that we could get to a steady 2 or 2.5 million vaccine doses per day. And these are not, one of the saddest things that has taken place during the pandemic. Obviously, the deaths and cases and economic implications and psychological impact for so many people have been terrible. But one of the saddest things that we've also seen has been the realization that the people in charge really do make a difference. What the politics are of your governor in dealing with the pandemic, it really makes a difference. Whether there is a competent federal government response really makes a difference. When you have people like Jared Kushner saying, well, the stockpile is our stockpile, it's not for the states, that's just not a disgusting political statement that you see on TV. That has a real trickle-down impact, and hopefully we're going to see that improve. And it seems as though the American people are confident that it is improving. Joe Biden with the highest initial approval rating in 28 years. Let's talk about that now. One of our sponsors today is Lucy, and they are giving my audience 20% off. Lucy is a company founded by Caltech scientists with only one mission, which is to help people quit smoking and vaping by offering a clean, affordable nicotine alternative. Now, many of you know, you've heard the stories. I've known several people in my life who have struggled with quitting smoking. I've seen how difficult it can be. And nicotine alternatives can be hugely helpful. Lucy offers a nicotine gum in 3 flavors: wintergreen, cinnamon, and pomegranate. They also have lozenges, which come in cherry ice flavor. Lucy is affordable. It'll ship right to your door. You don't have to go out to the store. Shipping is always free. You can buy single boxes or save with a subscription. It's time to throw the cigarettes away and get rid of the vape, and Lucy can make it easier. You'll find a ton of excellent reviews online from countless people who have used Lucy to quit smoking and vaping. Go check them out at lucy.co. I've put the link right underneath this video, and you'll get 20% off when you use the coupon code Pakman. And just a quick disclaimer I'm required to give: these products contain nicotine. Nicotine is an addictive chemical.